girls, it's Khaki. I hope everybody had a wonderful Christmas. Today, I would like to talk about a subject that I have had a lot of requests for and that I know really confused and concerned me before I had gastric bypass a year ago: dumping syndrome. It's very confusing to some people, and even me sometimes still, what can trigger dumping syndrome and what exactly it is. So let's talk about it. With some surgeries are more likely to experience dumping syndrome than others. A gastric bypass, it's fairly common. Not everybody experiences it, less so with the sleeve. And we'll talk about maybe why that's a good thing and a bad thing later. But first off, there are two separate types of dumping syndrome. There is early dumping syndrome, which typically happens within the first hour, sometimes just a few minutes after eating, and then late dumping syndrome, which can happen 2, 3, 4 hours after eating. So, the first early dumping syndrome that we're going to talk about, what is that? When you, as a gastric bypass or sometimes a sleeve patient, eat things with a high fat content or more rarely high sugar content, that high sugar content a lot of times will lead to the later dumping syndrome that we'll talk about. But when you eat high fat foods or things that are a little bit harder for your new stomach to digest, like sometimes white bread, when your food gets into your pouch and it's very small, there's not a lot of time for it to be broken down and digested into a more easy to handle form by your small intestine. So you get dumping of that food that's not really ready for that small intestine very quickly. Your small intestine says, "Oh no, I can't handle this." So it pulls in water to help break down that food that's not digested enough for it and other hormones. This type of dumping, this early onset dumping, causes what it sounds like dumping would be: nausea, diarrhea, sometimes dizziness, sweating. It is more gastrointestinal side effects. You may have to run to the bathroom right away. You may have to throw up. This is early onset dumping. Again, usually caused by fats, by foods that are not really broken down by your new stomach pouch, or sometimes by sugars. I personally have never experienced this kind of dumping, but I have experienced late onset dumping. Late onset dumping is actually caused by low blood sugar. If any of you have ever experienced low blood sugar in the past, you are familiar with how it feels: dizziness, tachycardia, your heart beating very fast, sweating, um, confusion sometimes. Just, it's a terrible feeling. I'm sure the early onset dumping is too, but I can speak to the late onset dumping more. You, what happens is when you eat simple carbohydrates or too many complex carbohydrates or the wrong combination of foods, when your food that you have eaten is dumped into the small intestine and there is a lot of glucose in that food that you have just eaten, your body will react by trying to lower your glucose very quickly. You've eaten something with a lot of sugar, a lot of unrefined carbohydrates, dumps into the small intestine. Your small intestine says, "Oh no, we have a lot of glucose coming. Let's spike up that insulin." So your body slams on the insulin production to bring your blood sugar down. Well, the reality is you may have a spike in blood sugar due to that, but then that insulin goes crazy, brings you down very quickly. And that's actually what you feel is that low blood sugar. I do experience this. I have found that sometimes I can experience it if I eat too much complex carbohydrates. For example, even low glycemic fruit when I have eaten a protein bar not too long ago. Those two on top of each other may be a little bit too much. I had a few episodes of this late onset dumping syndrome, and I started wearing a Freestyle Libre, which is a continuous glucose monitor, so I could kind of see exactly what caused it for me. And it's really insightful. It might be something that you would consider speaking to your primary care provider about writing a prescription for you just for a month or so you can get more insight. But I found that any type of simple carbohydrate can do it for me. Or, like I said, even good carbohydrates in the wrong combination can do it. So, what are those simple carbohydrates? What are those complex carbohydrates that are less likely to cause it? I have found in my practice and personally, I don't drink fruit juice, but I have found more patients complain about dumping syndrome when they drink their sugars, when they drink their carbs, fruit juice, colas, anything, monster drinks, anything with simple carbohydrates in it. Your body is not having to put any work into trying to break that down. So it's going to hit that small intestine intact, and your body is going to go, oh no. So, my biggest advice, don't drink any sugar sweetened beverages. Number two, pure sugar, white sugar, those simple carbohydrates, even those high sugar fruits that have good sugars in them, but like bananas. If you eat too many bananas, it can happen. Grapes are another one that have a lot of sweetness to them, a lot of simple sugars that your body doesn't work very hard to break down. They're good for you, but just be aware. I find it helpful to look at the glycemic index of fruits to see what fruits are more towards those lower glycemic index. You're going to find things like berries are going to be your most friendly option. My other suggestion, avoid those things like cakes, cookies, even your sugar free still have carbohydrates in them that your body, if they have white flour, that your body doesn't break down very well. And it hits that small intestine, and you're going to have a glucose induced insulin response. The other thing that I have found, both in my personal journey and with patients, is if you eat fruit or you eat carbohydrates, don't ever eat them alone. Always eat them with a protein. So let's say you like grapes. Eat grapes with some cheese or some cottage cheese. You like bananas. Put a little peanut butter on it and make sure to limit the portion. Anything that is a fruit or a more carby vegetable like sweet potatoes, yams, anything like that, make sure that you're getting plenty of good protein or fat. That slows down the absorption of that glucose so that it doesn't hit your small intestine with still a lot of that glucose intact, high amount, and then provoke that dumping episode. The other thing is trial and error. And unfortunately, it's not always the same. The last dumping episode, late onset dumping episode I said earlier, I had some good, healthy berries, but I had had a protein bar, even though it was a low carb, low sugar protein bar, too close to each other. There you go. It was not a good scene. Alcohol also can cause it. If you choose to drink alcohol, make sure you're getting protein with it. So, guys, if you have any questions about dumping, I would love to try to help you answer that. If you have any other questions, please post them below. I'm not a bariatric surgery expert, but I am a bariatric surgery patient and a primary care provider, so I'll do the best I can. If you have any suggestions for future videos, I would love to hear them and I'll add them to my list. I hope to make these videos that are informative for everybody and that people can really get something out of. So I want to put out what you want to hear. On a personal note, my husband was back in the hospital last week, so it's been a little bit of a stressful time for all of us, but we're doing much better now. And thank you for all of those who reached out and sent well wishes for his health. I will see you next Wednesday, and like I said, any questions, post below. I hope everybody has a great week. Bye.